Hi, how are you doing today? I'm Eric, I'm a nurse practitioner student. I'm here to do a head-to-toe assessment on you. I had to wash my hands before I came into the room. How are you doing today?
Good.
All right. Patient appears to be in no apparent distress, dressed appropriately for the current situation, appears to be well-groomed and has no odor emanating from her at this time. So tell me, what's your name and your birth date?
Brianna, 6/11/97.
Awesome, awesome. Okay, do you know what date is today?
9/23/7.
Very good. And do you know why you're here today?
I need a physical exam.
Okay, do you know where you are right now?
The hospital.
Very good. All right. The patient appears to be alert right at times 3 at this time. Do you have any allergies?
No.
Okay, great. Okay, do you have any pain anywhere right now?
No.
All right, perfect. We're going to go ahead and we're going to start with the head-to-toe assessment. We're going to start at your head, okay? So, looking at your head, all right, your head appears to be symmetrical. See that the patient has no lumps or masses noted. The hair is evenly distributed, and it seems to be that there's no lesions or any signs of bugs in the hair. Skin is warm, dry, and no signs of moisture at this time. So give me 1 second to get a pen light here. Okay, what I'm going to do is I want you to do a couple of things for me first. I want you to close your eyes as tight as you can. All right. Go ahead and open your eyes. I want you to lift your eyebrows for me. All right, great. Can you make a smile for me? All right, show me the teeth. Okay, next I want you to puff your cheeks as wide as you can. Very good. All right, so cranial nerve number 7 is intact. Okay, the other thing I'm going to do, I want you to close your eyes. I'm going to touch you. I want you to tell me where I'm touching you.
Forehead, cheek, chin.
All right, perfect. Cranial number 5 appears to be intact this time. So, we're going to take a peek at your pupils at this time. You got the pen light coming in. Look straight ahead for me. Very good. All right, there is direct and concerted constriction of both pupils. I want you to look straight ahead for me. Look right at it. Okay, there's also convergence. So pupils are equal, round, reactive, and accommodate light. Okay, we're going to take a peek at your mouth now. I want you to open your mouth for me. Okay, all the teeth appear to be present and evenly distributed. Lift up a little bit for me. I don't see any lesions inside the mouth at this time, and the mucosa appears to be quite moist. I'm going to have you stick your tongue out for me. Look inside there. Say ah. Open up. Say ah. Okay, the tonsils seem to be present in a +1 grade. The uvula raises and protrudes midline as appropriate, as expected. Okay. Okay, what I'm going to do now is I'm going to go ahead and feel your carotid pulses on both sides. All right, the carotids are a 2+. They are not weak and they are not bounding. What I'm going to have you do now is I'm going to listen to your carotid arteries. I want you to take a breath in. I want you to take the breath out, and go ahead and hold your breath while I'm doing this. So I'll set this to bell at this time. Go ahead and take your breath in and let your breath out. And just hold it right there. Okay. Take your breath in, take your breath out, and hold. Very good. There is no swishing, which would indicate any bruise in either one of your carotid arteries. All right, so what we're going to do now is I'm just going to go ahead and feel in here. We have warm temperature and both arms as appropriate. I'm going to check your brachial pulses. The brachial pulses appear to be even, 2+, not weak, not bounding. Radial pulses are also equal bilaterally, 2+, not weak or bounding. Take a look at your hands for me. Okay. Capillary refill is brisk, less than 2 seconds. The nail beds appear to be neatly groomed, no clubbing noted. All right. What we're going to do now is we're going to listen to your heart. We're going to start in your right side, second intercostal. We're listening for the aortic valve. We're also going to, this is the best place to hear the S2. All right, great. We're going to the left side second intercostal. That's the area where we're going to listen to the pulmonic valve, and also good area to hear the S2. Going to the S3, the third intercostal, which is Erb's point. You can also hear murmurs at this point. We're going to go to the intercostal on 4, which is the tricuspid. And we can hear S1 at this point. Go down to the mitral valve area, which is down in the 5th intercostal. Also hear S1. And out to the mid-clavicular 5th intercostal is where we're going to hear our apex, and we're going to listen to that for approximately 60 seconds. At that point, we're going to change back to bell, and we're going to go back from the 5th to the 4th to the 3rd, 2nd, listening for murmurs. Nothing appears to be there at this time. Okay, so what I'm going to do now is I'm going to listen to your breath sounds. I'm going to put this on your chest, and I want you to breathe in and breathe out every time I place the bell on you, okay? Okay, breathe in, breathe out. Okay, I want you to turn to the side. I'm going to go ahead and listen to the ones in your back. Here to the side for me, please. Okay, breathe in and breathe out. We breathe normally for a second. Very good, very good. Okay, stay right there for me. Okay, what I want you to do for me now, I'm going to take a look at your back, lean forward. And look at the spine. It appears to be midline, no signs of scoliosis. I want you to tell me if you feel any pain when I do this.
No.
Okay, anything over here?
No.
Okay, the CVA tenderness is absent. Okay, what I'm going to have you do now is I'm going to have you lay down on the bed right here, and I'm going to take a peek at your belly. I'm going to lift this up a little bit. You help me out, so it's up a little bit, just a little bit. All right, we're going to take a peek. I don't see any lesions or masses noted. Appears that there was a belly button ring. There is not one in right now. There's no crusting, no drainage noted. The belly is flat. Okay, we're going to go ahead and listen to all 4 quadrants at this time. Okay, there is vowel sounds in all 4 quadrants noted. At this time, we're going to do some percussion. There's tympany in all quadrants noted. And we could have some dullness in the right upper quadrant from the liver. We could have some dullness in the left upper quadrant from the spleen, and we could also have some dullness in the left lower quadrant if there was excessive stool in the sigmoid colon. So we're going to go ahead and press on the belly this time. Tell me if you have any pain.
No.
Okay. The right lower quadrant is the area where we're going to have the appendix, the right ureter, and the right ovary. The right upper quadrant, we're going to have the gallbladder, the liver, and the head of the pancreas. Left upper quadrant, we're going to have the stomach, the spleen, and the body of the pancreas. Left lower quadrant, we're going to have the left ureter and left ovary. Okay. I need you to sit up off the edge of the bed. Okay, so we're going to take a peek at your feet, down on your legs. All right, everything appears to be equal, temperature-wise, color-wise. I see no lesions, no nevi. Check out your popliteal pulses. They are present, equal, bilateral, 2+, not weak, not bounding. Check your posterior tibial pulses. They are also equal, bilateral, 2+, not weak, not bounding. Dorsalis pedis pulses. They are also present, equal bilateral, 2+, not weak, not bounding. Capillary refill is brisk, less than 2 seconds. Nail beds and feet appear to be in good order. Okay, what I'm going to do now, if I find my little toy, I want you to come across your foot here. All right, and on the other side. That is Babinski test. You are negative for Babinski. The toes did not curl. So what I need you to do at this point in time is go ahead and stand up for me. Okay. Actually, I'm going to have you do one more thing for me. I want you to lay down for a second. Okay, and I want you to come up slowly. And looking at the jugular vein, there is no distension noted. Okay, go ahead and stand up for me. Okay, what I want you to do now is I want you to close your eyes. Keep perfectly still. We're going to stay still for approximately 20 seconds. Close your eyes. Okay, no swing is noted. Rumber test is negative. Okay, you can go ahead and open your eyes at this point in time. What I'm going to have you do now is I want you to go ahead and walk toward the camera a little bit. And I want you to turn around and walk back. Okay, the gait is, appears to be steady, no shuffling noted. And at this time, that concludes our head-to-toe assessment. Thank you.